Here back on Art and Culture Monday, ready with Dr. Susan Hinga from the School of Health Sciences at Kenyatta University. I think I was saying Biashara Tuesday because Dr. Susan has been with me on that very show. And I'm glad to have her here on a different show. We meet at a different time, but also a very important discussion that we'd like to have here on International Men's Day, specifically zero male suicide. We're trying to get suicide amongst males to be at zero, especially here in the Republic, where majority of those affected are men. Welcome to the show, Dr.
Thank you very much. I'm happy to be here.
Happy
and thank you for having me.
Right.
On this tree planting day.
Yes.
I'm
happy holidays.
Happy green.
Happy green holiday. Are you going to participate in the tree planting exercise?
Yes, I will. I'll join in the exercise later after I'm done with this.
All right.
Yes.
Happy holidays also to all those who are watching the show. And welcome. Please introduce yourself. We've introduced you on a couple of shows, but I don't think we've done that here on Art and Culture Monday. Please do that and then we can get into it.
All right. My name is Dr. Susan Hinga. I'm a psychiatrist, a consultant psychiatrist, and a lecturer at Kenyatta University. And I'm also part of the Kenya Psychiatric Association. So as I sit here, I also represent the Association of Kenyan Psychiatrists, and I'm happy to be here.
Right. We're having International Men's Day on Sunday. Maybe we begin there and then we can come back into the focus of this conversation. Mm-hmm. Are men celebrated enough in our society as it is?
A good question. I get a lot of that being asked even on social media. There's even complaints sometimes that we have too many Women's Day. I guess with they mix up the Women's Day and Valentine's Day and many others that go around with it. But men are celebrated too. So that is why we have an International Men's Day, just like we have an International Women's Day. We have Children's Day and different other days that are celebrated. So we don't forget to celebrate men. So yes, men are celebrated, and we'll be doing so this Sunday.
All right.
Yes.
We'll be doing so this Sunday, but within Kenyatta University as well on Friday. The theme is, or the focus mostly of these conversations that are going to happen is zero male suicide. Why specifically this?
We're at a point where post-COVID, we were all, I think generally in the world, very hopeful that once we are past the COVID era, that everything was going to fall into place and people are going to function as they had, or even better after COVID. However, with the current economic downtimes that are happening, not just here in our country, but all over the world, there's been a lot of distress. And of course, the distress has affected all genders, both males and females, and even children. So it has affected every part or aspect of society. As a result of that, with the hopelessness that sets in and the difficulties in relationships that set in, the difficulties in people people struggling to put food on the table, people struggling to take care of their families, people struggling even to take care of themselves, there has been lots and lots of distress. And as a result of that, definitely when there's a lot of distress, then there's a lot of hopelessness, as I've said, and a tendency to have more suicidal rates.
All right.
Yes.
And within Kenya, what do the statistics now inform us?
We don't quite have, I would say, proper statistics in Kenya, but we do know that it's say that so often we have people who are dying by suicide. By the way, just to correct that, we talk of dying by suicide. We no longer talk about committing suicide. Okay. And the reason we say die by suicide is because we're working towards, as a country, looking at ways in which we can decriminalize suicide. So in the past, we have talked of committing suicide because it's been sort of like a criminal activity. But we know that lots of people die by suicide all over the world. We may not necessarily have statistics specific to a country, but it's not something we can ignore. Again, we may not also have proper statistics because in the past, when we've had attempted suicide as a crime, we probably have less reporting. less reporting of people coming into the hospitals, and so we wouldn't have the data. If people don't show up in places where that data can be collected, we definitely wouldn't have. So I do not think we have accurate data because of that.
Okay.
And we hope that as we work on decriminalizing suicide in our setting, in our country, that in the future we can have proper data on this.
Yeah, it happens to be really hard for men to come forth and, you know, say they're suicidal or, you know, they're going through this and that. Maybe one of those reasons could be some of those, issues within the law, like criminalization of suicide and other cases of stigma. Is that, are we getting better? I know recently we've just had discussion, and the Chief Justice already presented that kind of motion to ensure that, you know, people aren't taken, it isn't a crime for someone to attempt suicide. Are we making progress in terms of stigma?
We are. We're definitely not where we were several years ago. It gets better every year. The stigma is less. I mean, if you compare to 10, 20 years ago, the stigma is less. It gets better. And as it gets better, then people are more open to talking about attempting suicide. We look at attempting suicide as a person who is crying out for help. And that is why you'll see as mental health workers, we will advocate that let us decriminalize this so that we have more people who are coming out to say that I need help and that they're able to get the help.
Right.
So we increase the stigma when we look at attempted suicide as a crime. Because then the people who are seeking for help, the people who are dying inside and asking to be helped will not come out. Because if they do, they have a fear that they could be jailed or they could be arrested. So stigma has reduced and it could get better. I know it will get better, and thankfully that our Chief Justice is working on this and she's already put it out forward, and we hope that it will be supported by our houses as they debate on it and agree on it, so that then we can decriminalize suicide. So it's getting better. It's not where it was. Just to answer your questions about males, why aren't males coming out more? It's generally the way society socializes men. Well, and not just here in Africa, but all over the world. A man is looked upon to be strong and sometimes not even to show emotions, not even to show that they're collapsing and dying on the inside. They have to look strong because that is partly how people have been socialized. So unfortunately, sometimes that socialization does affect the fact that it will cause men not to seek help because they fear looking like they have failed.
All right.
So part of why we have more women probably reporting and saying I have failed, or I feel I'm not coping or getting overwhelmed, and being able to report is because of the way society is socialized. So the stigma, in my opinion, tends to be more for men.
Right.
Because a man, again, as I've said, is looked upon to be strong, don't cry,
cry inwards.
Cry inwards, as you say. So because of that, then we'll have fewer men are coming out to say that they need help.
Would you say the primary causes of suicide amongst the males is different as compared to females in society?
The causes may not necessarily be different. They'll probably differ because of the social functioning that's expected of men, sometimes in comparison to females, women. But, you know, society is very dynamic. And if you compare now, you probably have seen some women who have had to take up roles of men, being single parents, and they're the mother, the father of their families, and they're fending for their families and the same. So it may not necessarily be very different in terms of presentation. Like, for example, when we think about some of the causes, like if you have mental health illnesses being part of the causes, the presentation of a patient with depression, whether male or female, remains the same. What may be different is how they present themselves and how they bring out their issues. But at the end of the day, when we make a diagnosis, for example, of a patient with depression, it's the same, whether you're male or female. That doesn't change.
Okay.
Yes.
All right. I was just having a discussion before we came on here with a couple of the men who are here with us on the show, asking them if they're depressed or they know someone who's depressed, or they've ever heard of someone who's committed or who's died by suicide. That's the correct phrase to use there, and I'm going to try and do that throughout this show. Died by suicide. They're saying sometimes you might not know that you're in a suicidal state. How does someone get to identify that they're in a state where this might lead them to suicide?
Okay, it's two-way.
Okay.
One, the patient themselves may identify, and on the other side, the people around the patient may identify. Maybe let me start with, how do people around those who are thinking of suicide, how would they identify? The first thing that we tell people as mental health workers is that we need to be cautious about people whose mood or way of doing things generally changes. For example, how when you notice fluctuations in people's moods, when you notice withdrawal with people, when you notice a change of behavior in terms of interactions with others, when you notice a reduction in their functioning socially or occupationally, when people start to talk about what happens if I'm not around, what would you do if I'm not around, or talk about even sometimes methods that they could be thinking about. The telltale signs could just be what I've just said, just looking at somebody who has changed in terms of their behavior, changed in terms of their moods, changed in terms of their interactions, and people who are talking about death frequently and talking about the future, and in some instances even giving out what they value. There are people who look at what they value and they slowly start to give out. Or people who even start to look for things that they could use to die by suicide, looking for firearms, for example, looking for poisons or buying poisons, or looking for medications, for example. So it's looking out at those things that can make the people who live with these people be aware that something is not okay. However, on the other side, we have the individual. There are people who are much more aware that something is not okay. And they would probably walk even to a psychiatrist and say, I don't feel well, I feel overwhelmed, I feel like I want to take my life, and they get help. There are others who may not necessarily put it out that way, but as they come, they may have all these aches and pains and things, and it's their way of trying to tell you that I'm not feeling well. So I have a headache, I have my leg is paining, my heart is paining, my chest is paining, my this and this is paining. And sometimes they probably will show up even in our health facilities and get all tests done, and nothing seems to point to this aches and pains that they're talking about. And the health worker may actually identify. So it could be the patient coming on their own, already identified that they have a problem, or the people around the patient, or the people the patient interacts with, for example, in health facilities, or even at work or at school.
All right.
Yes.
Having a look at also a different kind of scenario where, and this is also coming from another campaign which I saw last week, where, there's a happy individual here, there's a somewhat troubled individual we think is troubled, and it's just a video footage of them meeting every day. So at first it seems like the guy who looks troubled might be on their way to taking their own life, and then it happens that the overly bubbly individual and cheerful happens to be the one who took their life. So there's this very small percentage of individuals who are always happy, cheerful, but then later it happens and you're like, this guy was so happy. We just talked yesterday. How do we approach that kind of situation? If I have a friend who's always cheerful, I have a family member who I know is always happy, and then something might happen someday. How do I tell the signs in the midst of their order?
Let me start by correcting something. I know the general perception in society or in the world is that every person who dies by suicide was depressed. That is not necessarily true. A large majority of them may be depressed. In fact, let's start by saying a large majority of them may have a mental health issue. They may have a mental health, even a psychiatric diagnosis. And the large percentage of this is likely depression. However, depression is not the only cause of a patient dying by suicide or attempting suicide. I'm saying this because, going back to your explanation, people get surprised that this person looked happy. This person looked like they were getting on in their lives. What suddenly happened? Sometimes people die by suicide because of impulsive behavior. And this could be impulsive behavior that again happens with some of the mental illnesses that we patients have. A patient, for example, with bipolar who's on the high side, the hyper side of it, or a patient with a psychotic disorder would still die by suicide, not necessarily because they are depressed. So it's this perception of society that everybody who dies by suicide or who attempts suicide is necessarily depressed. It's not always the truth. They may have other mental illness, and sometimes there may be no mental illness, but it could be an impulsive act out of a reaction, a sudden reaction of anger or something that happens to the patient, and impulsively and quickly they act and they lose their lives. So it's not necessarily true that everybody has a mental illness or everybody is depressed, those who die by suicide or those who attempt suicide.
Right. And I guess it's then important to have this discussion continuously, even if it's not for the people who look like they're depressed, even people who look normal, everyday individuals, to prevent those cases of, sudden thoughts or, as you said, the impulsive decision making as of such. Let's talk about the effects. Are there effects on the individual? Because mostly when we are having a conversation on people who've died by suicide, it's, it was their last solution out. Are there effects to them before we get into the effects to the family and society?
Okay, now this is when you consider suicide.
Impact on the individual, yes.
Let me first take you to a discussion. I'll divert it a little bit for us, for our own understanding.
Sure.
As we think about suicidality these days, we have more understanding of it. And if you look at our categorization, we have what we call 4 parameters that we think about when we think about suicidality. The first parameter is a patient could just have suicidal thoughts. Okay, so a patient would think, if I slept and didn't wake up, then that would be good, and all my problems would be solved. Okay, it could go on to it becoming suicidal behavior. It could go on to being attempts where people start looking for ways in which they can hasten this going away and running away from these problems and just getting away. Or of course, or it could just be completed suicide. So it's in parameters or phases of suicidality. Again, we look at it with more understanding these days in 2 ways. Of course, we have that suicidal behavior that I've just described that moves all the way from thoughts and may go all the way to completed suicide, unfortunately. But we also have what we call non-suicidal self-injury. It is something we're coming to understand, that we have people, especially adolescents, who are cutting themselves, who are burning themselves, or self-inflicting some damage to tissues. Okay, so we now have better understanding that this, besides suicidal behavior, we also have this self-injury, and as I said, it's more common in young people. Now, back to your question: what effect does it have on the person? I'm not sure. It really has an effect. Okay, we try to intervene at the point at which the patient has suicidal thoughts or has suicidal behavior. Of course, if the person already has an attempt and they're successful, unfortunately we may have lost the battle. But at the point at which the other 3 parameters are happening, we do try to intervene. And part of what we do is, if we pick that the patient has a mental illness, then we treat the mental illness, whether it's through drugs, or in addition to drugs, we could also do talk therapy, where we talk to the patient and discuss the issues that could be troubling them. So through pharmacotherapy, or using drugs, or through psychotherapy, which is talk therapy, we try to help and assist the patient, and sometimes to help them see that there's light at the end of that dark tunnel. So at that point, when the patient decides they are done, all they're seeing is darkness, and sometimes just going through therapy, they may probably see that there's light at the end of the tunnel. Yes.
All right. Let's talk about the community. How does suicide affect the community? There's been, and I'm getting this from the environment that I'm in, which is Kenya, and the places and the people I interact with. It's usually let's not, after someone's taken their life, let's not have a conversation about us. It's they've left us like this, they've left us like that, or they've left their family if it's a breadwinner, or if it's a mother with children. But these are still real. Real impact that they do have. Apart from this, how can we also approach the effect after the case, after it has happened?
Suicide is one of the things that we regard in psychiatry as an emergency.
Okay.
Or suicidal attempts are a psychiatric emergency. This is because, as I've said, of the realization that when somebody is attempting suicide or is threatening suicide, then we know that this person is looking for help. I've said, unfortunately, that if we do lose the patient, then of course the society is left to deal with the act that has happened. First, let's start with the immediate family. That, of course, it's very devastating, and the immediate family will go through, of course, a shock, the denial, and sometimes going through phases where they're asking themselves, could they have done something, or did they do something that caused their loved one to die by suicide? And those who are left behind are troubled by this person who has taken their lives. So as a society, one of the things that we keep pushing for is do not make the family that has been left behind suffer more. And one of those that I always pick up and talk about is, unfortunately, sometimes our religious circles may be part of this, where the loved one of a family has passed on, and then the religious authorities decide that they will not go through the religious rites for this person to be laid to rest because of the act that they have done, because of certain thoughts that they have that it means that if somebody dies by suicide, this is what it means.
Right.
That is very devastating to family members. You can imagine if they have to bury their loved ones in the absence of these religious authorities, who at that point offer solace and help to comfort this family. So we need to be careful as a society that we are not part of the problem. This person has died by suicide. Let us support the family. Let us not add more to the family by making them blame themselves or making them think that they're not worth it because nobody is coming for their loved one's funeral, for example, or nobody is taking over the rites that need to be done for their loved one. So as a society, we need to be careful in the religious aspect. Again, as a society, we need to be supportive and stop stigmatizing people. There are people who go around and say, you see, in that family, so-and-so died by suicide, so that means... And they have very many explanations. Again, we need to be careful. Let's be sensitive to these people. If a family has lost somebody who's died by suicide, they are actually people who we as mental health workers really worry about, because at that point, with the devastation and the distress that this family is going through, we want to be careful that we would not lose another person.
All right.
So society needs to be careful that let us use that time, if it happens, to comfort this family, to be of help to this family, and let us not stigmatize or be quick to judge and sometimes to make very wild comments that are very hurtful. Yes.
I have here a question from a mail, and I think I'd just like to sneak it in. It's Nguti is asking, once someone opens up to me that they are suicidal, what should I do?
Very good question.
Right.
Thank you for that.
What does someone do at that point?
Let's start by saying, do not be judgmental when somebody does. To listen to this person. Sometimes all it calls for is to allow for them to talk, and you listen. The other thing you could do is offer help. If you're not able or in a position to give help, encourage this person to seek help from a health facility. If they have opened up to you, that's a good thing. And the other thing is, please don't post it on social media for the whole world to know. You subject this person to cyberbullying, and even when they get out of this, and everybody will be talking about it, including their employer, you have not helped them. You've increased the stigma. So if somebody confides in you, discuss it with them. Discuss with the loved one if you really must, support them, and again, help them or encourage them to seek help from a health worker.
All right. Is there a role that mental health resources plays in addressing these issues, and how can we access them to help the men around us?
We talk about it, like what we're doing today.
Yeah.
Part of what we're doing today is talking about it so that people know this is what it is they need to know about suicide. We encourage it even in social media circles. We discuss it. So wherever we are as mental health workers, we allow it, and we talk about it in many circles. And we discuss mental health issues. And part of why we do this is to reduce the stigma. Because if we didn't talk about it, then people wouldn't know how to seek help. So what we are doing, even as I said, as a Kenya Psychiatric Association member, I go about in whatever circles I have, whether it's family circles or circles, social circles, discussing about it. And we do that. So we encourage health workers, not just mental health workers, health workers, to go out there and talk about it so that people know that they can be helped.
All right.
Yes.
Just here on zero male suicide, is it possible for us to get to zero? And what exactly are we going to do? I know we've discussed about, having conversations, just like the ones we're having, being more open and, moving away from stigma. What more can we do to ensure that it's at zero? Zero is a big number for this context. Yeah.
Sure, zero is a big number, and it's very ambitious of us that we are positively ambitious that we can achieve zero male suicide. We wouldn't probably have zero suicide in society. Our aim is to reduce suicide.
Yeah.
Achieving zero, as you said, is not an easy task, but our aim is that we should reduce on suicide levels. And the reduction we're trying to do is talk about it so that those who are having suicidal behavior, those who are attempting and are screaming out and saying, I need help, get the help. And hopefully that as we do this, that we could save a larger number.
Okay.
Yes.
All right. Zero male suicides. That's the conversation we're having here as we prepare for International Men's Day, going to happen on Sunday, celebrated all over the world, but also here within Kenyatta University on Friday. Are there activities that the School of Health Sciences is preparing for?
I know part of what activities was to come on our TV channel as Kenyatta University and discuss about it. And of course, besides Kenyatta University community, I know we are impacting the whole country and wherever KUTV is watched. We don't have specific activities lined up, but I know over the week we will be discussing mental health issues, which is part of what we think is most important, to get out there, to get not just our community in Kenyatta University, but even in the country and the world at large, to understand what is it that we can do.
All right. I'll also be sharing a couple of suicide emergency numbers and helplines in a few. So if you're out there needing help or online therapy or just a text, a phone call away, I'll be sharing those numbers in just a while. But as you heard there, on Friday, a couple of activities could be happening within Kenyatta University. I know the Student Association will also be informing us of what they have ready for the students, especially the male students within the institution and also the whole faculty. Just one last one, maybe to someone who's out there and they're watching this and what they've been used to, and I'm speaking this for a couple of people who are around my life, and it's really hard for these men to even open up to another man. It's like, they'll probably dismiss it or they'll have nothing to help me with. So if it's an economic issue, I got a job loss, or I lost a loved one, or niliachwa tu na niko na heartbreak, na mimi nacheza rugby, I am bulk, they know me as someone who's too strong. As we started earlier, men are the pillars of society. Just a word to them to also seek help, that it doesn't reduce your stature as a man in society.
Just to add on to what you've said and to help answer your question, yes, we need to go out there and tell people that they can be helped. One of the phrases that in mental health you hear us use a lot, we usually say, it's okay not to be okay.
Yeah.
Not because we justify and are happy with people not being okay, but the reason why we say it's okay not to be okay is for people to realize that not being okay is not a state that you need to hide or not talk about. It's okay to be in that state, but it's okay for you to seek help. So what we are advocating for out there is, if people are feeling they are not okay, if people are feeling overwhelmed, can we go ahead and encourage them without stigmatizing them to seek help?
All right. Without stigmatizing them, and then help them as well to seek help. If you're within Kenyatta University, is it possible to talk to someone, and will I be referred to to a specialist later, or are they still within KU? If
yes,
I needed to talk to someone.
In Kenyatta University, we do have facilities with the students. We do have facilities where students can go and seek help. So we have lots of counselors who are available in our setting. We also have our health services where you can also I'll say patients, but students and staff can also go and seek help. And besides that, beyond Kenyatta University, in every health institution, it doesn't have to be a psychiatry facility per se. Every health institution has the ability to manage psychiatry emergencies of suicide, that's attempted suicide or even suicidal behavior. So let's not just zero in only on thinking everybody must show up in a specialized psychiatry unit. Every health worker, for example, every medical students who we teach and who I teach, for example, in Kenyatta University, is well versed on how to take care of patients with mental health disorders, including how to deal with suicidal behaviors. And I believe that is the same training that every medical doctor in this country has. So it's possible that wherever you go to a health facility, whether you're meeting a medical doctor, a psychiatry nurse, or a psychiatry clinical officer, or even just a general practitioner, they're all trained in managing mental illness. If then they think it's beyond them, then they can refer. So there is help everywhere. There is help in Kenyatta University. There is help in our country. There is help in health facilities, whether public or private facilities.
Right, trying to get us to zero male suicides, especially here within our republic, where that is at a high rate. I was taking a look at, I think I've shared this before on my show, but just maybe one more time here on Art and Culture Monday. There's a growing alarm in Kenya over the shocking rise in the number of suicides, and almost 500 people are reported to have killed themselves in 3 months to June this year, and that is according to the Kenyan police alone. This is the statistics from the Kenyan police, so there could be more out there. The youngest person here was 9 years and the oldest was 76. A majority of this, they're saying, is males. It's a ratio of 1 to 3 when it's female to males within Kenya. So a report here that you can read for yourself in The Guardian that was published earlier in the year. We've had this conversation and you can get to check it out later. I think this is important for you to continuously be aware and also be referring to these effects and what the impact has within society for the individuals, the family, and the society as well. I think being together as a society will be really key in ensuring that all of us are feeling warm within the environments that we exist in. It could be hostile at work, it could be hostile at home, but I think if in general the community you exist in is very welcoming to men to open up, I think it will be easier for us in this goal of trying to get us to zero male suicides. I'll be sharing those helplines in a short while as well, but just let's get, if there's a last word from you that maybe I had left out, and then we take this short break.
My parting shot is what I've just said is a common phrase. It's okay not to be okay. Please seek help.
All right, seek help. And also plant trees today. It could be very healthy for your mental health. So go out there, it's the holidays, plant trees and celebrate with the rest of society. And also maybe this could be a chance for you to open up to a few individuals as you do this community-based tasks also in celebration of the holiday. Now, coming up next is also men are out there engaged in war in Israel, in Sudan, in the Congo. They're also being affected by the very harsh effects of war within us. There's a song out. This being Art and Culture Monday, we're using all our art to ensure that we are fixing whatever cultures are there within us. And then coming up for that kind of conversation, also to look at his song, which is trying to talk about the effects of war, is sDay. He's a singer, actor, and film director. Also appeared in the Transformers, the latest Transformers, as a voice for that wheelboat that I already talked to you about. So sDay joining us on Zoom live all the way from Venezuela. You don't want to miss out on that conversation. Engage us on the social platforms. I'll be right back.